tuning in. Okay, so what I've been noticing is nursing tests are a whole other ballgame. A lot of you will study, spend hours reading, and then you take a test and you bomb. And you tell me, I just don't fail tests. I'm normally a straight A student. I don't understand what I'm doing or what's going wrong. Why is this different? So today I'm going to discuss how to take a nursing test, what you need to do, what are the steps, and there's an acronym that I like, and we're going to go check that out now. How to take nursing tests, and this one's going to give an example of therapeutic communication. So this is an important foundation for your mental health course, therapeutic communication. Okay, so I want you to think of the acronym RACE. Recognize, ask, critically think, and eliminate. There's a book series that I like, and it's called the Davis Success Series, and they print great books on questions and things like that. I highly recommend whatever semester you're in, check those out. That's just I'm not sponsored by them or anything. I just think that they have some really great books. So again, think RACE. Recognize, ask, critically think, and eliminate. So what does this acronym mean? Recognize. Recognize the key words in the question stem. So for example, yesterday there was a question I was teaching my students, and a lot of them got the question wrong because it was asking about therapeutic relationship, how to establish a therapeutic relationship, and they jumped right away to putting something along the lines that assess was first. They're so used to hearing assess, assess, assess for other things, right? We are taught in nursing school that you're always assessing your patient as soon as you walk in the door, right? But to establish a therapeutic relationship, that was the key word in the question stem. So recognize the keywords in the question stem. So we have a question here, simple NCLEX question that I got from a book that's been reviewed and edited. A depressed client states, I desperately want to get pregnant, but my husband is not so sure we should have children. Which response by the nurse would be an example of therapeutic communication? Key word in this question stem, we see what the client is stating, but specifically, which is an example of therapeutic communication. So which response by the nurse is effective? Because in mental health, we teach about therapeutic and non-therapeutic communication. Again, recognize the keywords in the question. Next is ask. Ask what the question is asking the nurse to do. So what does the question want from me? And here's the question again. And what is it asking? It's asking the student to identify which response is therapeutic. So once again, when you're taking nursing tests, read the question very carefully. Don't assume, don't bring things in to the scenario. Read what is there. Then you're going to critically analyze. Critically analyze each option and compare it to the question stem. So the answer choice number 1 is, why do you think that your husband has doubts about having children? That was A. Well, a fun test-taking tip in mental health world is that if a question has the word why in it, you can eliminate it, but we'll get to elimination in a little bit. But just by saying that why, I would discount it. I wouldn't even compare it to the question stem, because why is non-therapeutic in mental health world? So I'm critically analyzing that. I say, oh, why? That's a non-therapeutic. Therefore, the keyword in the question stem, which was asking me, what is therapeutic? Next, I'm going to the next answer choice. You still have time to convince him. I'm sure he'll change his mind. That's giving false reassurance. Again, is false reassurance therapeutic or non-therapeutic? It's non-therapeutic. Eliminate. What makes you think that your husband doesn't want children? And then you say to yourself, that sounds like maybe exploring, and exploring is a therapeutic technique. And then the other one is, talking about this will make you anxious and increase your depression. We're kind of discounting them. We're supposed to be there for them when they're, for example, let's say that you're trying to vent to someone and they're like, don't talk about that. You're just gonna bless your heart. You're just gonna stress yourself out, right? So when we think about which is the only one that sounds therapeutic, this is a pretty easy question. There's not even another distractor. Usually, the test makers will have two answer choices that sound really good, and you have to eliminate and go down to one. So right now, what makes you think that your husband doesn't want children? That sounds pretty good. It sounds like we're exploring there. And this is again what each option is telling you. So why do you think that your husband has doubts about having children? That's requesting an explanation, and that is non-therapeutic, and that invokes defensiveness. Giving false reassurance, I'm sure he'll change his mind. That's non-therapeutic also. And that answer choice is exploring, and as we've said before, the question stem was asking for therapeutic, and talking about this will make you anxious and increase your depression is the non-therapeutic block of rejection. Next, we want to eliminate. Eliminate as many options as possible to increase your odds. So we already said number one is non-therapeutic. Why? If you see why in a mental health exam, stop. You're done with it. Don't even read the rest of it. Okay, number two, you still have time to convince him. I'm sure he'll change his mind. Again, non-therapeutic, eliminate. Technically, the other ones too were the fourth one was also non-therapeutic. But let's say you weren't sure. You just eliminated two. You're down to two. And now let's end again with the question. A depressed client states, I desperately want to get pregnant, but my husband is not so sure we should have children. Which response by the nurse would be an example of therapeutic communication? One, we eliminated why. That's it. That's as simple as it gets in mental health. And again, this applies to any other test or subject that you're taking in regards to nursing. It's just in mental health world, we have little tips, additional tips that can help us. You still have time to convince him. I'm sure he'll change his mind. Remember, this was false reassurance. And what makes you think that your husband doesn't want children? Again, that sounds pretty good. Even if you don't know it's a therapeutic technique of exploring, okay, we're going to put that one in our back pocket and we'll come back to it. Talking about this will make you anxious and increase your depression. Remember, that was a therapeutic block of rejection. But even if you don't know that's non-therapeutic, just how it sounds doesn't sound therapeutic. Talking about this will make you anxious. Just stop. I don't want to hear your complaints, So the answer choice was, what makes you think that your husband doesn't want children? That was the correct answer. And to end this, welcome to nursing school, where every week feels like finals week. Okay, so thank you so much for watching. I hope that helps you a little bit in regards to how to approach nursing questions. And remember, this acronym works for every facet of nursing school, whether it's med-surg, pediatrics, mental health. It works for everything. Thank you so much for watching. Make sure you hit the like and subscribe button and tune in every week for new content. Bye.